This presentation focuses on the programmatic factors that enhance the quality of life of farmers with disabilities that participate in the National Agriability Project. The National Agriability Project is a project that operates nationally, the goal of which is to enhance and protect the quality of life of farmers with disabilities to preserve their livelihoods in agriculture. They focus on education, networking, as well as direct services, um, including services like assistive technology, modifications, and other things. The goal of the project is also to promote growth and independence in clients, and so that it increases the likelihood that they will remain active in production agriculture. For this study, past clients of the Agriability Project were rank ordered based on their scores on two quantitative scales, the quality of life measure as well as the independent living and working measure, which were quantitative outcomes measures that data was obtained on before. The clients were then rank ordered from highest to lowest, and then the top ranking clients and clients who had the highest as well as the lowest scores, they were selected to be able to participate in this study. A total of 9 past clients were interviewed for this research. The key themes that emerged included programmatic factors as well as some client level factors. The programmatic factors included factors that were facilitators and some that proved as barriers. Of the facilitators, the first most important factor was the comprehensive farm assessments and recommendations. Also, assistive technology recommendations and modifications that the project provides was appreciated a lot by the clients. These are either done in-house or are done externally through referrals. Um, the third factor was the funding that they obtained for equipment or modifications. In most cases, the funding is from the local vocational rehabilitation agency, and in some cases from other agencies, including nonprofits. The fourth factor that had a huge influence on client outcomes and their satisfaction was their relationship with the staff, ongoing communication with the staff, and the trust they had with the staff members, which also determined timeliness of services. Um, in terms of barriers, there were some factors including communication gaps with the project staff, and some barriers focused on the vocational rehabilitation agency, including the counselors, the VR counselors, not having enough knowledge about farming, farm tasks, and the farm culture. Also, lack of expertise on specific disabilities, including sensory disabilities like vision and that type of expertise. Delay that's caused due to VR in terms of the excessive paperwork, delay in services, the eligibility criteria, and the ineligibility, those kind of issues also played a role in terms of client participation. Some client level factors included clients' intrinsic motivation, also the skills that the clients had. The other factor that was important was the extrinsic motivation of clients. So clients who, how supportive were the family members, how supportive and cooperative were the project staff members, those type of factors. And then technological limitations. So if some clients had more trouble adopting certain technologies, then that kind of proved as a barrier. Family level factors also had an influence. Clients who had more support from their family to make changes and adaptations were likely to benefit a lot more from the project than others. But also, if there was some other extrinsic family thing going on, for example, if someone in the family had a health issue, then that did impact how much the farmer was able to participate in the agriability project. So a lot of it for in terms of clients revolved around intrinsic factors, how proactive the client was. Clients who were more skilled and more proactive are much more likely to go on YouTube and find things and make adaptations themselves. And so in turn, they were able to make a much more positive impact in their quality of life and their mobility compared to other clients.